Welcome back to our third health education video. Today, we will be talking about the different treatment options for end-stage renal disease, including in-center hemodialysis. If your doctor says you're nearing end-stage renal disease or stage 5 chronic kidney disease, then you need to start thinking about transplant or dialysis treatment options soon. As you begin the conversation with your care team about which treatment option is right for you, remember that you're not stuck with this option for life. The treatment that's right for you right now may not be tomorrow, and you can always speak with your doctor about changing. Here are a few considerations to help inform your decision. Do you like to lead an active lifestyle? Do you want more control of your schedule and time? Do you currently have daytime obligations such as work or school? Do you want to consider performing your own dialysis treatments? Do you want to do your treatments at home or in a center? Do you have someone available to help you with treatments at home? Let's take a brief look at the different treatment options.
Kidney transplant is the preferred treatment for kidney disease because you have the freedom to enjoy life with no dialysis-related schedule restrictions and virtually no diet or fluid limitations. However, you will be on medication to prevent rejection of your new kidney for the rest of your life. Furthermore, the wait for a kidney transplant varies greatly from person to person, and success of the transplant is not guaranteed. Dialysis uses a special fluid that contains a mixture of pure water and chemicals to carefully pull waste, salt, and extra water out of your blood without removing substances the body needs. In turn, you'll be able to keep safer levels of certain chemicals in the bloodstream, including potassium. There are two main types of kidney dialysis: hemodialysis and peritoneal dialysis. Let's take a closer look to see how each type of treatment works. Peritoneal dialysis uses the lining of your abdominal cavity, called the peritoneal membrane, to naturally filter fluid and waste from the blood. During treatments, a cleansing fluid called dialysate is put into the patient's abdomen through a small, flexible tube called a PD catheter. The dialysate pulls the waste and the extra fluid from the patient's blood into the peritoneal cavity and stays in the abdomen for a specified amount of time. Once the dialysate is drained, the waste and fluids are also drained, and fresh dialysate is replaced to clean the blood, which is called an exchange. Peritoneal dialysis usually preserves remaining kidney function for a longer period of time than hemodialysis. It can be performed at home or work and does not require needles, and blood never leaves the body. On peritoneal dialysis, people have fewer diet restrictions and more travel flexibility. It is often done at night in your home for 8 to 10 hours using an automated cycler machine while you sleep.
Hemodialysis uses a filter outside of your body called a dialyzer. With help from the dialysis machine, blood flows from the body into the filter where waste and fluid are removed, and then back into your body. There are three common forms of hemodialysis: in the comfort of your own home, in a dialysis center with other people, and in a center that offers nocturnal dialysis, which is performed while you sleep. Home hemodialysis is performed in the comfort and privacy of your own home, which allows for flexible treatment times that can be arranged around your treatment schedule. Typically, a care partner is needed to assist you with treatment. People on home hemodialysis have the option to dialyze more frequently to achieve improved health benefits. Short daily treatments are generally performed 5 to 6 times a week for 2 to 3 hours per session. In-center hemodialysis is performed in a dialysis center. During hemodialysis, trained medical professionals are with you at all times. There is also more social interactions with staff and other patients. The usual schedule for in-center hemodialysis is 3 times a week for about 3 or 4 hours each treatment, plus travel time to and from the center.
Let's take a closer look about how hemodialysis works. During hemodialysis, a machine removes blood from the body and filters it through a man-made membrane called a dialyzer to clean out toxins that your kidneys can no longer remove. The filtered blood is then returned to the body. Only a small amount of blood, less than 2 cups, is outside of the body at any time. To perform hemodialysis, there needs to be an access point created to get the blood from the body to the dialyzer and back to the body. Typically, an arteriovenous or AV fistula will be surgically created. An AV fistula is created by directly connecting a person's artery and vein, usually in your non-dominant forearm. This procedure may be performed as an outpatient operation using local anesthetic. As blood flows to the vein from the newly connected artery, the vein grows bigger and stronger. You are taught to do exercises such as squeezing a rubber ball to help the fistula mature for use. This takes 6 weeks to 4 months. Once the fistula has matured, it can provide good blood flow for many years of hemodialysis.
Again, one size does not fit all when it comes to treating kidney disease. All dialysis treatments have their advantages and disadvantages. Many people with end-stage renal disease have thought about switching treatment programs, whether it is for medical or lifestyle needs. Hopefully, you have learned more about different dialysis treatment options, which you can further discuss with your healthcare providers to decide whether or not making a change would be right for you. Thank you for joining us again today. I hope you learned something about the different treatment options for end-stage renal disease and which one is right for you. Next time, we will be discussing the dialysis diet. The highest proof of the Spirit is love. Love is the eternal thing which men can already on earth possess, as it really is. Albert Schweitzer.